Good afternoon, folks. I've got B for you. Okay, now we're discussing this afternoon we're discussing what dying people want most before they pass. Okay, so with that in mind, here's the presentation. Dying people most want honesty, presence, and permission to talk about what matters to them, not platitudes or rushed fixes. Simple actions, listening, asking about priorities, help with practical wishes, and honor their choices make the biggest differences. What patients say matters most. Palliative care physician Dr. Simran Mohoita reports that patients often express whether they feel at peace or worry they haven't finished living. Younger patients frequently say they're not ready to die and more and want more time. These conversations reveal priorities that family and clinicians can act on. Stanford palliative experts emphasize that honest, clear conversations about prognosis and goals are what many seriously ill people want from clinicians, delivered with sensitivity and tailored to how much detail the patient wants. Asking open questions like, what are you hoping for? Or what matters most to you helps align care with the person's values. Practical things you can do right now: be present and listen. Silence and attentive presence are often more comforting than trying to fix feelings. Ask about priorities and fears. Use simple open prompts. What matters most to you? Or is there anything you want to say or do? Offer honest, compassionate information. Don't avoid the truth out of fear. Many patients prefer clarity so they can make meaningful choices. Help with legacy and unfinished business. Encourage letters, recordings, or practical tasks that ease later bereavement. This reduces regret for both patient and family. Respect wishes and small comforts. Prioritize symptom control. Favorite foods. Music or visits that the patient values. How to talk without causing harm. Avoid glitches and minimizations. Phrases like everything will be fine can feel dismissive instead validate feelings. I can't imagine how hard it is. I'm here for you. Follow the patient's lead. They want to joke, reminisce, cry, or plan, match their tone and place or pace, balance honesty with hope. You can acknowledge limits while focusing on what can still be done to improve comfort and meaning. Why this matters: open communication and aligned care reduce suffering and regret for patients and families. They also improve bereavement outcomes when people leave with fewer unfinished conversations. Palliative care exits exist to manage symptoms and coordinate care so those final priorities can be honored. Dying people or dying patients overwhelmingly want clear, compassionate, honesty from clinicians so they can make meaningful choices and put their affairs in order. So they also want to be heard about what matters most to them. Be direct, but be passionate, compassionate. Patients often already sense they are dying and prefer clinicians who explain prognosis and options in plain language while exploring the patient's priorities. What experts report: patients want to know the truth about their illness and likely outcomes, though the level of denial desired varies by person. Clinicians should ask how much information the patient wants and tailor the conversation accordingly. Honest conversations reduce fear and regrets. When clinicians discuss prognosis and goals early, patients and families make care choices that better match values and experiences, less distress later. Avoiding the topic causes harm. Systematic uh, avoidance of end of life conversations leads to late referrals to palliative care, more aggressive interventions than the patients would choose, and missed opportunities to improve quality of life. How clinicians can do this well: ask before telling. Start with questions like what do you understand about your illness and how much would you like to know? To match the patient's information preference. Use tested conversation guides Tools such as the Serious Illness Conversation Guide help clinicians explore hopes, worries, acceptable trade offs, and what a life worth living looks like to the patient. Balance honesty with empathy. Deliver clear information, but pair it with statements that validate feelings and offer support. For example, I know this is hard to hear. I'm here to help you through it. Openers. What have you been told so far about your illness? What are you hoping for? To assess trade-offs. How much are you willing to go through for the possibility of more time? To offer support. I can't imagine how hard this is. I'm here for you, and we'll make a plan together. Why this matters for families and clinicians. Early honest conversations improve decision quality, reduce unnecessary interventions, and help patients leave fewer unfinished matters for loved ones. Health systems and training programs are increasingly emphasizing communication skills so clinicians can have these conversations confidently. Okay, the next section of this one is the last days of life. Patient guide explains what to expect in the final months, days, and hours of life, how common symptoms are managed, and what decisions families and clinicians often face. It's a practical, evidence based resource for patients and caregivers. Give me 1 second, folks. I'll be right with you. What it covers, overview of typical physical changes, near death syndrome management, pain, breathlessness, agitation, discussions about life sustaining treatments, and palliative sedation, what to expect in hospital or hospice settings, and grief and bereavement resources. Key facts patients and families should know. Timing varies. End of life can mean months, weeks, days, or hours. Planning should begin early and be revisited as the illness changes. Common physical signs: decreased appetite and fluid intake, increased sleep or withdrawal, changes in breathing, and reduced responsiveness are typical in the final days to hours. Hearing often remains intact, even when a person seems unresponsive. They may still hear Families are encouraged to speak and offer comfort. Symptom control is central. Pain, shortness of breath, nausea, and agitation can usually be managed with palliative measures. Clinicians should discuss goals and trade offs with patients. And families. Decisions about interventions. The guide explains choices about CPR, artificial nutrition, hydration, antibiotics, and ICU care, and stresses documenting wishes in advance directives. Practical checklist for caregivers: what to do now. Ask and document wishes. Confirm advance directives. Healthcare proxy and preferred place of care. Talk with the care team. Request clear explanations of prognosis and symptom plans. Ask what to expect in the next 24 to 72 hours. Comfort measures, mouth care, moist swabs, repositioning, familiar music, and presence often matter more than food or IV fluids in the last days. Prepare emotionally and practically. Gather important documents. Plan who will be present and consider recording messages or reading letters if desired. Communication tips: how clinicians and families can talk. Be honest and compassionate. Ask, ask how much the patient wants to know. Use plain language and pair facts with support. Ask open-ended questions. What matters most to you now, and what are you hoping for? Help align care with values. Okay, guys, that's B for you. I will be back on later tonight for shows. I'll do 2 more tonight for y'all. For now, Gator Wellness. Take care, folks.